So pterygium, pinguecula. Symptoms: irritations, redness, decreased vision, may be asymptomatic. Sign: one of the following, almost always located at the 3 or 9 o'clock position at the limbus. Pterygium, a wing-shaped fold of fibrovascular tissue arising from the interpalpebral conjunctiva and extending onto the cornea, usually nasal in location. Pingueculae is a yellow, white, flat or slightly raised conjunctival lesion, usually in the interpalpebral fissure adjacent to the limbus, but not involving the cornea. Etiology: elastotic degeneration of deep conjunctival layer related to sunlight exposure and chronic irritation, more common in individuals from equatorial regions. Workup: slit lamp examination to identify the lesions and re-evaluate the adjacent corneal integrity and thickness. Check for corneal astigmatism in the axis of the pterygium. Treatment: protect eyes from sun, dust, and wind, for example, sunglasses or goggles if appropriate. Lubrication with artificial tears 4 to 8 times per day to reduce ocular irritation. For an inflamed pterygium or pingueculae, mild artificial tears (QID), moderate to severe, a mild topical steroid fluoroquinolone (QID), a non-steroidal inflammation drop keratolac may be used 2 to 4 times per day to decrease symptoms. If a dull is present, then apply artificial tears ointment Q2H. Surgical removal is indicated when pterygium progresses toward the visual axis. The patient is experiencing excessive irritation not relieved by the aforementioned treatment. The lesion is interfering with contact lens wear. Follow-up: asymptomatic patients may be checked every 1 to 2 years. Pterygia should be measured periodically to determine the rate at which they are growing toward the visual axis. If treating with a topical steroid, check after a few weeks to monitor inflammations and IOP. Taper and discontinue the steroid drop over several weeks once the inflammation has abated. A non-steroidal drop may be used periodically for short times for recurrent inflammation.